Welcome to CRH Talk, where we feature rural health professionals and dive deep into prevention, treatment, and building lasting health.
Welcome back to CRH Talk, everyone. I have a guest here today who is the director of our laboratory here at Cody Regional Health, and she also runs our HealthCheck, which is a great service that some of you may not know about in the community. So I wanted her to come down here. Again, like a lot of our other speakers, she is a busy woman. She runs a lot of things, and I just can't thank you enough, Megan, for being here to speak with us and speak with our audience. And so if you would, just tell us a little bit about who you are and why you do laboratory and how you got into what you do, because you've been here for quite a while, and you are an amazing asset to this organization.
Well, thank you very much, Ashley, for the opportunity to come down here today and chat with you on CRH Talk. Like Ashley said, I am Meghan Asay, and I'm the director of the laboratory here at Cody Regional Health. I'm getting ready to start my 17th year with the organization, and I originally started in the organization as a CNA in our long-term care center, and through different opportunities and education have worked myself up to be a director in the facility of the laboratory operations. You know, I kind of fell into the lab by accident. There was a job posting for somebody, they needed a phlebotomist. And I thought, maybe, I'll try that. And, we were a young family in town. And once I got into the lab, I never turned back. I knew that that's where I needed to be. And I kind of, just threw all of my time and energy and effort into learning everything that I could about laboratory medicine. And here I am today.
I did not know that. I have known Megan for quite a few years, and I did not know you were a CNA over at long-term care.
Yep.
That's
so
amazing.
That was my first job in the organization, and I am prideful in saying that I am the poster child for your opportunity to kind of grow in an organization here at Cody Regional Health, because coming from the bottom up is kind of my story here, and has kind of helped me stay very passionate about making sure that opportunity is for other people in the community as well.
That's great.
Yeah.
That's wonderful.
Yeah.
Well, Megan, maybe you can just tell us about laboratory and what you do and how you interact with all the other departments, because lab is something that is so vital in order for us to offer the healthcare services we do here. And I know that some things we can do right here on campus, other things we have to send out. But can you maybe just talk to the audience about why we're so unique in our rural area and the labs that we can offer?
So the Cody Regional Health Laboratory is a fully functioning lab that offers a significantly large menu of services for as rural as we are. There isn't a whole lot of testing that we have to send out reference-wise, especially seeing as though the normal labs that you want to have done on a consistent basis, those yearly labs that your provider wants to have, all of that is done within a day here in our lab. And, we also have gold standard high-tech methods like PCR that helped us move through the COVID pandemic and being able to treat our patients through the COVID pandemic with, high-end level testing options that not rural areas are usually performing.
Wow. Okay. Yeah, and Megan and her team too, they've always participated in our Reach Healthcare Camp, which in the past we've worked with middle school students, and lab was always one of the cool places that they wanted to go. But it is for a certain type of person that can take some blood too. And so
yes.
Maybe just tell us as well, what's the difference if I do need to go have my blood drawn for some tests, and I want, just my, like a women's panel, for example. I know we have a men's panel, right? And a women's panel.
Right.
How can someone get that done at a more affordable rate here?
Okay. So Cody Regional Health Laboratory has two different kind of testing options. So when you go and see your provider or your clinician for your yearly lab results, they can order your tests, and those tests will be processed through the traditional laboratory methods of billing insurance and so on and so forth. If we do have a secondary option, which Ashley kind of alluded to, being our HealthCheck program, and that is run out of our Cathcart Health Center Monday through Friday from 7 to 3 and till 1 on Fridays. And that is low cost, affordable lab testing. So that is not required to be ordered by a physician. You can dictate when you want to have that testing done. And we circumvent insurance billing, and you are required to pay for the lab test services when you have them done. There has been historically some confusion between, oh, my doctor ordered these tests, and then you go and have the tests done through the normal laboratory channels, and that would generate a bill through your insurance company. You have to specifically denote that you want HealthCheck testing done over at the Cathcart Center in order to get that special pricing.
Yeah, and that's one of the other reasons why it is great to have HealthCheck, because it's a lot more affordable. And I want anyone listening to this to understand the differences, because when you need, to get your thyroid checked or just a regular blood test, you're going to pay like around, anywhere from $75 to probably $100 and some dollars. I mean, that can range just depending on what tests you get done. But if you do have to have a provider read it, you have to go through the hospital channels. That overhead cost, what I'm understanding, and please pitch in here, that is where those additional costs then get charged, because now you're sending it to insurance. You're having professionals get involved. And those professionals are expensive to keep this ball rolling here.
Yep.
So Cody Regional Health, thankfully, has allowed us to offer this cheaper, affordable opportunity, which is called HealthCheck. And that's where we want you to make sure, let us know if you have any questions. Megan and her team are amazing at letting you know, yes, we can do this here. Maybe we need to send it out. Here's probably the price range you're going to pay if you do that. But you can call and get price check if you need to. I do that. I know that you've worked with me personally on that. So it's just nice to know what's going to come out of your pocket sometimes. And our organization wants you to know that there are options. Just make sure, you're contacting us and not getting, sideswiped where you're going, whoa, here's a bill.
Yeah, no, we most certainly want you to have the best experience and know all of your options as far as laboratory testing and pricing prior to you coming in and, like Ashley is saying, kind of being surprised by some things that can be quite expensive when you take certain tests into consideration.
Do you want to touch on, I know our rates are really low right now with COVID, but do you want to touch on a little bit maybe about, can people come in, get tested? Should they probably go to public health? What's the best option right now if someone considers maybe having COVID, or they just want to make sure if they're going on a trip, where are the best places to probably get tested at this time?
So the most common and affordable test for travel is through Walgreens.
Okay.
That's where we send the majority of people that are needing PCR COVID testing in order to travel. And the United States has made it incredibly easy for people to get their hands on at-home, over-the-counter testing that can be bought at at different drugstores, Walgreens, Walmart, stuff like that. So if you just want to know if you have COVID or have some mild symptoms, over-the-counter testing is a great option. And if you have symptoms that you are more concerned about, that's where we would ask that you visit either our ER or urgent care clinic to have that testing done.
Perfect. Yeah, I know that's just a common question that comes up, and we want to make sure that you know the best route if you need some tests done.
Yeah.
What else? Anything else we need to cover to let our audience know about?
And I didn't really touch back on a previous question of Ashley's, just kind of what laboratory medicine is. And, lab testing is a kind of behind the scenes part of the healthcare team, but 80% of a diagnosis that a doctor gives you is based on your laboratory results. So it's our job to kind of bring the science and clinical information to your physician that kind of helps develop that diagnosis. We're going to test your cholesterol level, that is going to go to your physician, that is going to in turn determine whether you need to have, some form of therapy, or if you're doing great and healthy. Our job is kind of been coined the science behind medicine. So we're just a bunch of scientists behind the scenes kind of testing anything that you can think of in order to help determine what a diagnosis is for you.
Yeah, and I do just want to, again, recommend that if you are feeling tired, sluggish, just not yourself, your blood can tell you a lot. And so just to go in and get a very simple panel done to see where you're at, so you can share that at your next, primary care provider follow-up or your annual physical. It's good to just go in and have that ready to go, and we just encourage you to utilize the HealthCheck program that is at a very affordable rate. So.
Right. And routine lab testing is a great preventative medicine measure to kind of keep track of things. Your blood test results can sometimes say things about what's going on in your body before you even have symptoms. So it is, yearly labs are a great thing to practice.
Okay. Yeah. All right. Well, Meghan, thank you so much again for coming down here to speak with us. And we want to encourage anyone out there, if you have any questions, let us know. I can get in touch with Meghan, but you can comment below, and I'll have all of the contact information for our laboratory in our show notes. So thank you so much for joining us, and have a wonderful rest of your day.
Thank you.
Thank you for listening to CRH Talk. Please subscribe, rate, or share this podcast. Check us out at codyregionalhealth.org and see what services we offer locally in Northwest Wyoming.